Again, welcome everybody. You have joined the Robert Wood Johnson Foundation Systems for Action Research Program and our regularly recurring Research in Progress webinar series. I'm Glenn Mays. I direct the National Program Office for Systems for Action and am a professor here at the University of Colorado School of Public Health. For those of you who might be new to our program or new to this webinar series, we are a national research program supported by the Robert Wood Johnson Foundation. And our mission is to study innovative ways of helping medical, social, and public health systems work better together, align their efforts and activities to address and promote issues of health equity across American communities. We use this webinar series a couple times a month to spotlight interesting research happening in our research program. For today's session, we actually have a very special version of our webinar, edition of our webinar coming to you today, in that we are featuring colleagues from the National Collaborative for Health Equity. And I know that there will be a lot of interest in what our colleagues have to say and share with us in terms of strategies for achieving health equity by eliminating racism. I will just in terms a little bit of logistics for today. Again, this webinar, as all of our webinars, it is being recorded today. So if you have colleagues who are not able to join us for the live portion of the webinar, you can check back on our website in a couple of days on the systemsforaction.org to access a recorded version of this webinar along with slides. And if you registered for today's webinar, you'll also receive links to those via email. We will have some time toward the latter part of today's hour to consider some questions that you are welcome to submit for our panelists today to entertain. And so to submit a question, we ask you to use the Q&A box or the Q&A icon that you should see on the bottom toward the center of your screen. Click on that Q&A box at any time, and you can type in your question. We'll get to as many of those questions as we can during the Q&A portion of today's webinar. So with that, I'm going to turn it over to Dr. Gail Christopher, who is Executive Director of the National Collaborative for Health Equity, to kick off our panel and to introduce other members of her team for today. Thank you, Dr. Christopher.
Thank you so much. And it's such a pleasure to be here with all of you today and to share our insights and to listen to your questions and to answer. I'm Gail Christopher, and I want to introduce the two of our team members. I'll do it briefly, but they will introduce themselves more fully as they speak. But Luz Benitez Delgado will be joining us, and Ina Robinson. So we will each share insights into our three major program areas, and I'm really excited to do that. The National Collaborative for Health Equity is committed to helping to end health inequities, but over the last 20 years, we have learned that ending racism is a requirement if we're ever going to succeed in ending health inequities. So I'm going to turn it over to Ina Robinson to talk about one of our program areas. Ina?
Thank you so much for that, Dr. Christopher, and greetings to each of you. My name is Ina Robinson, and I'm a program director at the National Collaborative for Health Equity, and excited to share about our Leadership for Health Equity programs. So the slide before you is a collage of our most recent cohort of the Culture of Health Leadership Institute for Racial Healing. The Culture of Health Leadership Institute for Racial Healing, or COLI, as we call it for short, is a new pilot program model informed by lessons learned from 7 years of supporting the Culture of Health Leaders program. Our lessons learned from the Culture of Health Leaders program included the need to design a less demanding approach for participants, to create a leader-led model to leverage work already being done with great success by organizations, and to connect to a broader movement to transform the inequitable structures grounded in racism, and recognize leaders within their own work through a leadership support and engagement model. The emphasis of the COLE program is leader-led, asset-based cohorts of seasoned and experienced leaders leveraging their experience and practices through the application of the Truth, Racial Healing, and Transformation Framework process. COLE is an 18-month program experience supported by the Robert Wood Johnson Foundation, and it launched in 2022. We currently have a total of 80 diverse leaders participating in this program across 2 different cohorts. Our leaders work across a number of key areas, including policy, law, economic empowerment, grassroots and community organizations, the arts, education, cultural preservation, environmental and climate justice, child welfare, public safety, public health, and healthcare, just to name a few. The first cohort began in May of 2022, and the second cohort launched this year in January. So the leaders represent many experts within the 5 TRHT pillars. The program is grounded in the TRHT framework, which you'll hear a little bit more about here soon. We create space in this program for leaders to exchange ideas and present work based on what they're doing in the field as it aligns with building a movement around the TRHT strategic framework. So candidates for the COLE program undergo a rigorous application and selection process. Candidates are assessed on their understanding and impact for TRHT work, their experience and comfort level with interacting with peers, their ability to expand networks, demonstrated application of tools, resources, or practices supporting their TRHT work, and their ability to understand the complexities of their own and others' varied experiences. The COLE program consists of 4 key phases. The first phase is grounding in narrative change and racial healing. Phase 2 of the program is grounding in the TRHT framework through small group sharing experiences. The third phase is a retreat with the goal of leveraging TRHT through deeper collaboration. And the final and 4th phase is applying the TRHT framework through collaborative working groups. The core program components include virtual, live, and asynchronous monthly sessions, peer learning and sharing opportunities, ongoing small group meetings, coaching, retreat experiences, NCHE staff hours, engagement in an online community of practice, and self-directed time, which creates space for a lot of emerging of organic meetings and connecting on similar interest and topic areas in the field. One of the hallmark components and driving levers of this program is the executive coaching experience. The coaching experience supports our leaders in establishing a reflective leadership practice centered on self-awareness, authenticity, integrity, and efficacy. This experience is individualized, it is flexible, and most importantly, responsive to each leader's needs or concerns. And speaking of executive coaching, we will now navigate to the next slide to share a short video clip with you from one of our cohort leaders reflecting on their executive coaching experience through the program.
Hi, my name is Shannon Stokes, and I am a part of cohort 1 of the Culture of Health Leadership Institute for Racial Healing. I am in the economy pillar. I am a 24 this year attorney in the government space who also works heavily in diversity, equity, and inclusion, lectures and training and coaching. I'm here to discuss the benefits of coaching. And you all, I have never done coaching before, like ever. And it has been like a lifesaver. I've been in my profession again for 24 years this year, and I've learned so much about myself. At first, I was a little hesitant, just because I hadn't heard it before. We don't typically do that in government areas. And I had heard some of my colleagues, my white colleagues, have access to it and would talk about it. And so when it was offered as part of this cohort, I jumped right on it. And my coach, and he has been amazing. He's brought balance. He's I'm at that age where you're trying to figure out, like, I'm doing this and what's next, or I'm going to do this and in conjunction with. And he's allowed me to like look deep within myself and realize that I've held the answer. So often we look outside externally to try to find what we would need. So it's been a balance. It's been allowing me to feel the moment. That's not my strong suit. I'm very kinetic. Let's go, let's go, let's go. So it's he's given me tools about how to be reflective, to go from just, you know, having a good experience to making a valuable experience, and to how important reflection is to personal growth. As a Black professional, what I would not have done to have had this tool in my toolkit in the beginning of my career, or even in the middle. And I guess I'm still in the middle, but I'm maybe 10 to 15 years ago, this would have been even more dynamic. So I'm just, you know, grateful for the time that I have it now, and I want to maximize it. I just can't speak enough about it. It has opened my eyes to so many things. It's allowed me to see where I need to cut the fat, where I need to dig deeper. And it's not external, you know. It's like he mines the information. They mine the information from within, and it really is a confidence booster. And I know that, you know, some of us, based on implicit bias and all these things, you know, we can have imposter syndrome. I realized that I had it in some areas, and it just showed me that everything that I have it, that I need, I have within me. And I'm so very grateful to this foundation, to this experience, and to my coach, Steve. Just, I'm growing leaps and bounds. I'm growing professionally, I'm growing personally, I'm growing spiritually.
Thank you so much for sharing that video. And as we reflect on the video and the words shared by Shannon, by way of quick update, she is now planning to run for a political office appointment, further evidencing how this coaching component and support is elevating leaders' engagement and influence within the systems that we all operate. So at this time, I will now hand it over to my colleague Luz to talk about the National Collaborative for Health Equities Research, Data, and Information Systems programmatic work.
Thank you, Ina. Before we start the introductory video, I'd like to introduce myself. So my name is Luz Benitez Delgado, and I am the Deputy Director for the National Collaborative for Health Equity, overseeing programs and strategy. And thank you, Ina, for sharing our leadership work under the leadership strategy for NCHE. The Leveraging Hope TPHD to Transform Public Health Data Systems is under our research, information, and data strategy. I would like to share with you a short video from our research and technical data partner, Derek Chapman, at the Virginia Commonwealth University Department of Society and Health, and with a small intro from our Executive Director, Dr. Christopher. Can you please play the video? Thank you.
Another pillar that's central to our work is relevant data, information, and research. And we have a wonderful initiative that we call the Hope Data Initiative that reframes data, not just to reinforce and reiterate the inequities, but to set measurable goals to achieve health equity.
The VCU Center on Society and Health has been a partner with the National Collaborative for Health Equity on the HOPE project since the project's inception in 2018. And I've served as the lead for my center's team throughout this time. If we can't or won't measure health inequities, we cannot properly prioritize actions to address them. So one thing that's clear across the nation and the various HOPE measures is that we cannot achieve good population health without addressing the gaps by race, ethnicity, and socioeconomic status.
We're very excited that our Hope Data Initiative enabled us to gather a set of indicators and to group them in domains that are all focused on what people need to have the opportunity to live healthy lives.
Thank you for sharing the video. So funded by the Robert Wood Johnson Foundation in 2018, NCHE developed the HOPE initiative. HOPE stands for Health, Opportunity, and Equity and is a social determinants of health approach to health equity. The HOPE initiative provides an interactive data tool designed to help states and the country move beyond measuring disparities to looking at opportunities towards health equity. HOPE tracks social determinants of health and health outcomes by race, ethnicity, and socioeconomic status. As you can see from the slide, there are 27 indicators organized into 5 domains, 1 for health outcomes and 4 domains that influence longevity and well-being. Next slide, please. HOPE's approach stands out from other population health measures because equity is its focus and vision. It uses an opportunity frame to shift the narrative from deficits to opportunities. The goals are aspirational reference points based on what leading states have achieved, which helps unveil what's possible. And the distance to goal quantifies overall and by population subgroups, such as race and ethnicity, poverty, and education, whose health or opportunity would need to improve to meet the HOPE goal. HOPE calculates 3 important factors that help state and federal leaders, advocates, and other stakeholders shape policies and practices. Where the gaps in opportunity are among people of different races and ethnicities, what goals for achieving equity look like, and how far they need to move the dial to make these goals a reality. For example, 2,044,691 Ohio adults would need to live in households with a livable income to meet the HOPE goal, 88%. Black adults in Ohio face the greatest challenges in being able to own homes and earn a livable income. They are also least likely to live in opportunity-rich areas with low rates of poverty, homicide, and robbery. Our unique analysis calculates how to achieve goals to improve life outcomes, especially for populations of color most affected by systemic racism. Because of this, and because health inequities in communities of color became more evident during the COVID pandemic, in 2022, the MacArthur Foundation was drawn to us as they developed an equity recovery initiative during COVID. They asked that we expand the use of the HOPE Index to social justice and health equity organizations. The idea is for them to use this framing and database as a catalyst for increasing policy and practice changes in 10 local jurisdictions to promote health and racial equity in communities disproportionately harmed by the effects of COVID. Next slide, please. NCHE has developed a community of practice, originally with 10 organizations highlighted in bold in these 2 slides, working at local, county, and state levels to address historic and pandemic-related systemic barriers to health. Although multiple challenges regarding data availability, data reliability, and suppression made the process of setting HOPE goals at all sub-state geographies less straightforward than state-level data, they identified various workarounds to help local organizations adopt the HOPE domains and approach. For example, when subgroup data were not available for distance to goal calculations by population subgroups, they found that the approach used for area-based measures in the state-level HOPE initiative can be an effective substitute. In the area-based approach, the distribution of subgroups in areas, for example, tracts or zip code tabulation areas that did not meet the HOPE goal are used as a substitute for direct measurement of the distance to goal among subgroups. This results in a slight change in interpretation, but it still allows important comparisons among population subgroups. So instead of quantifying the number of persons not meeting a HOPE goal, the area-based distance to goal will identify the number of persons living in an area that does not meet the HOPE goal. Through this community of practice process, we learn not only about how to apply the data to local health equity work, but also about the inspired and diverse approaches to this work at the community level. The original 10 organizations in the first phase of our community of practice have nominated now 12 other organizations to join for a second phase of this community of practice. Now a 22 organizations community of practice, they will continue building the field to support communities and leverage an impact on policy and systems change. This second phase includes a mentee role for the first 10 organizations. We would like to share 2 examples from the 10 original organizations on how they use and will continue to use the HOPE interactive data tool. For example, in Baton Rouge, Louisiana, the goal of Louisiana 40 by 2030 initiative is to improve Louisiana's national health ranking by 40% by the year 2030. The Louisiana Center for Health Equity is combining local, regional, and national data as well as HOPE data in support of its Louisiana 40 by 2030 initiative to create data-driven decisions that can be piloted throughout the 9 regions in Louisiana. Another example in Connecticut, Health Equity Solutions advances health equity through anti-racist policies and practices. In the past 2 years, they helped advance state legislation to declare racism a public health crisis. They also serve on several state work groups and councils to embed health equity in public health, Medicaid, and health insurance exchange policies, and address barriers to health beyond formal health systems. Health Equity Solutions routinely hosts listening sessions with coalitions, and they engage in outreach and education with communities, policymakers, and health professionals to advocate for policy changes. Their listening sessions on health equity priorities of people across the state informs their advocacy, which is community informed at minimum and community led whenever possible. Their use of the HOPE data at their listening sessions has provided an asset framing that has invigorated engagement and commitment for policy and systems change. Health Equity Solutions will continue using this concept in their messaging with stakeholders, policymakers, and local advocacy groups to reinforce that there are attainable and concrete goals for health equity. As a practice, they never share disparity data without context because it is so easily misconstrued and often used to blame people for their population's experience with racism. Next slide, please. This report from our research and technical assistance partner, VCU Center on Society and Health, evidences the research and analysis report on the outcomes and recommendations of the first phase of the 10 original organizations in our community of practice. Part 1 is the analysis and research on the HOPE interactive data tool, and part 2 are the reports from the 10 original organizations. The HOPE data is currently being revised with federal data that is available at this moment by Dr. Marsha Lilly Blanton. Dr. Blanton is adjunct professor of health policy and management with the George Washington University Milken Institute School of Public Health. To learn more about the HOPE interactive tool, you can look at the technical methods report provided in the resources link further on in the presentation. Now I will leave you with our executive director, Dr. Gail Christopher, who will share with you the Robert Wood Johnson Foundation Commission to Transform Public Health Data Systems. She will also share with you the Truth, Racial Healing, and Transformation Strategic Framework, as well as a partnership with the American Public Health Association and the De Beaumont Foundation. Dr. Christopher?
Thank you, Luz. Wonderful explanation, and thank you, Ina. I want to really emphasize that at the National Collaborative for Health Equity, collaboration is in the center of our name. And while we hold and continue to develop the HOPE Data Initiative, it was created in partnership, as Derek said in the slide, with the Virginia Commonwealth University Center for Society and Health, as well as the Texas Health Institute. And you're going to hear a lot about partners, philanthropic partners, organizational partners. This framework for truth, racial healing, and transformation, it was launched by the W.K. Kellogg Foundation back, I think it was 2016. And we see the Kellogg Foundation as a funder and as a partner in this important work. Let me begin by saying that we were privileged to be able to work with the Robert Wood Johnson Foundation and to serve as director of their recent commission to transform public health data systems. The work went on for more than a year with a lot of original research and landscape analysis being done by the RAND Corporation. And then the foundation picked some exemplary leaders to come together and deliberate and come up with a set of recommendations for how we transform our public health data systems to address the persistent, seemingly intractable challenges of health inequity. We were able to adapt this framework, the Truth, Racial Healing, and Transformation Framework, in the creation of that deliberative process, and it undergirds the recommendations from that commission's work. And much of that, those recommendations are influencing how our country is transforming at the federal level and at the state and local level, transforming our approach to data now in light of the brutal realities that COVID-19 inequities presented. The Truth, Racial Healing, and Transformation Framework, as I said, was launched by the W.K. Kellogg Foundation, and there is an implementation guide for communities. It is both a national effort, but we understand, like all politics tend to be local, certainly transformation happens at the local level. And so this is a picture of the implementation guide, and you can access that in the resources that we provide and at the W.K. Kellogg Foundation website. Now, we've taken this concept of truth, racial healing, and transformation, and if we could go back to that slide very quickly, I want to just go through the pillars of that framework. Ina mentioned that the pillars of this framework, they undergird our leadership program, and they certainly undergird work that communities are doing. The first is narrative change. And our HOPE Data Index and interactive web-based tool and the related community of practice is an example of using data to change the narrative, but also it's an example of changing the narrative about data away from a deficit to an opportunity frame. The second pillar of the framework is the critically important work of building relationships. In this work, we call people into transformation. We don't just call people out on the issues of racism and the legacy of a hierarchy of human value that has been used to shape America. So we have very specific methodologies about racial healing grounded in the neurophysiology of well-being. And perhaps that's a different webinar to go into the depth on that. But racial healing, bringing communities together, bringing diverse people together, and finding ways to move forward together. You know, a core part of TRHT is having a vision for the future, not just a focus on the negative, but a vision for a positive future that we can create together. The other three pillars of the framework are answer the question, how has this insane idea of a hierarchy of human value remained embedded in our structures and systems for so many centuries? And we answered the question through separation, through myriad forms of separation, sometimes isolation, but by keeping people apart, we're able to maintain the fallacy and the beliefs in racial hierarchy. Through a legal system, in many aspects designed to maintain that structure of racial hierarchy, and through an economy that's fueled by that belief system. Ultimately, racism is a belief system, and this comprehensive framework of truth, racial healing, and transformation is designed to address the belief system as well as its manifestation in our systems and structures. Next slide, please. Next slide. Now, we have had the privilege of working in collaboration with many groups. When the TRHT was first launched, the Kellogg Foundation, again in collaboration with many local foundations, funded several local places to implement TRHT according to the guidance of that implementation guide. And there are now 16 communities across America that are implementing the TRHT at the local level. And we're creating a community of practice at the National Collaborative that is supporting the work of those communities. We're also privileged to be working in partnership with the De Beaumont Foundation and the American Public Health Association. You know, now almost 250 jurisdictions have declared racism as a public health crisis. And we were able to work in partnership with these other organizations to curate and to examine the policies and practices, the innovative policies and practices that communities are putting in place that align with the TRHT framework. And that's available as a set of briefs at no cost. It is also in the resources that we'll be providing. It's called Healing Through Policy, and it's also healing through practice. Sometimes the policies become legislated or in some ways codified. In other instances, they're not codified, they're emerging practices. So we're excited about that resource, and we certainly invite you to access that resource. But this is a movement, it is a national movement, and this video gives you a little hint of how that movement is evolving. Could we have the video, please?
America needs truth. Our people need healing. Our society needs transformation. But how? We've had commissions before, and we still have not learned the lessons of our past. This time will be different. This time, we will learn from the wisdom of our communities and engage in a national grassroots effort to write a new American story.
Ultimately, racism is a belief system. It's an ideology. It's a way of seeing the world. And it is the legacy of that belief system that we live with.
The work has already begun. In small towns and city centers, meeting in libraries, churches, and on college campuses, from Alaska to Louisiana.
How do we get over our fixation on this absurd notion of racial hierarchy?
Since it was developed by nearly 200 experts in 2016, the Truth, Racial Healing, and Transformation framework has been used by dozens of communities across the country with the goal of uprooting the conscious and unconscious belief in a hierarchy of human value. To craft the framework for local TRHT commissions, we drew on the study of over 40 global examples of truth and reconciliation commissions. The framework is simple but powerful, and it works. Truth, Racial Healing, and Transformation guides folks through a process of learning and unlearning that ultimately creates a new community history, one that doesn't hide the ugly truth and weaves the stories of all local peoples. Over years of experience, practitioners have learned that relationship building by stakeholders in the community is an essential ingredient to overcome divides. On this basis of healing through storytelling and understanding, community members collaboratively craft plans for creating transformational change to the laws, economic rules, and physical structures that keep us apart and unequal. Empowered by a national commission and fueled by grassroots energy, Truth, Racial Healing, and Transformation will help usher in a new America that lives up to its highest ideals, where all of us can thrive.
Thank you for watching the video. As of now, over 70 college campuses across America, through partnership with the Association of American Colleges and Universities, they have created Truth, Racial Healing, and Transformation campus centers. And several of our national legislators have responded to Congresswoman Barbara Lee and Senator Cory Booker's call for a national commission. At last read, I think we were up to about 170 co-sponsors around the country. So I would leave you with the final thought that at the National Collaborative for Health Equity, we have three primary areas of work. As my colleagues and I have presented, we support local leaders. We don't develop them, we see them as developed. We try to support and resource and network them. We continue to build more research information and to make available data that can support their creative efforts. We build communities of practice, and all of our work is informed by this need to end racism, to create health equity, recognizing that without a comprehensive approach to the effort, we won't succeed. And the framework, the strategic framework of Truth, Racial Healing, and Transformation enables us to take that comprehensive approach. And I think we can open it for Q&A at this point.
Fantastic. Thank you so much, Dr. Christopher. And thank you to Ina Robinson and Luis Benitez Delgado for this amazingly useful tour through the great work that's being done by the National Collaborative for Health Equity. As a member of the research community, I want to thank you for all the work you've done in this space and for these resources that are really helping lots of us around the country who are studying health issues figure out how to reposition our research to be responsive to the need to dismantle racism and racial hierarchy that are embedded in the health and social systems that we're studying. So this is really amazing work and amazing resources that are available to those of us who are working in the research space. So we are open for questions now, as Dr. Christopher said. We invite you to use the Q&A feature. You should see down in the lower central part of your screen. Click on that Q&A box and type in your questions. And we'll get to as many of those as we can. And I'll take the as folks are thinking about questions, I'll take moderator's privilege and ask a general one to get us started to Dr. Christopher and our other panelists. As you're thinking about the work of the National Collaborative for Health Equity and thinking about its intersection with the health research enterprise, are there some priorities that you or some areas of special focus in thinking about where the research community needs to go to support the larger agenda around dismantling racism and racial hierarchy across the U.S.? What are some directions you'd give to the research community generally in this space?
Well, first of all, thank you for the question and for the opportunity to collaborate on this webinar. I think I'll be guided by the framework, and we need to take a deeper dive into this moment of narrative influence, if you will. Every major social movement in the history of America happened to occur when there was a major shift in media. Back in the abolition era, it was the emergence of newspapers across the country. The civil rights movement took hold during the advent of television. And certainly this era of social media has spawned much of the activism and the movements that we see today. But it's a runaway train, and it can be used negatively and positively. And so I really encourage folks to take a deeper dive into this era of media transformation and come up with some guardrails and some guidance that will help us to make sure that this new creation of, what is it? TikTok has access to 150 million Americans for more than an hour every day. That is an unprecedented experience in influencing the thinking and the consciousness of a society. And so that's one critical area where we need more research, and we need to connect the dots between that phenomenon and health and well-being, as well as sustaining biases and inequities. And I would invite my colleagues, if they have any answers to other areas of research that we need.
Sure, I would be happy to respond in thinking about this in some additional ways from, the research perspective and the data perspective, the importance of, in this work, elevating, the lived experiences of those most impacted, elevating the community needs and the community voices. So sort of taking that community-based participatory approach. And that gets into, the various pillars that we've highlighted today in terms of changing the narrative and closing the gaps with the separation, and fostering sort of that healing and that relationship building, so that, again, the needs of the communities and those most impacted are centered and elevated as we're moving forward in this particular work.
Thank you, Ina.
Thank you, Ina. I'd like to share that as far as data is concerned, it's important to increase data accessibility, to collect and report more granular data, to review data suppression criteria in publicly available data sets, and of course, to use the HOPE approach with existing data sources. One of the things which we shouldn't be surprised, but we always are, is the surprise with communities when the HOPE index was presented to them to see how they were faring in their state. They had no idea how, they were faring as far as livable income, adequate housing, health disparities, and it just really opened their eyes. And these are people that have been working in the field for a long time, but to literally see their own community, disaggregated data on how they're faring in these social determinants of health was a great awareness building and a motivator that they can actually literally now zone into their own county or state to devise some goals that can get them to where they want to be. So those things on data are very important because we don't have enough data or awareness of the data at community levels.
Thank you. And I would also add that, this notion of healing communities, it's a relatively new concept, although it's grounded in the practices and principles that have guided indigenous cultures for years. But in this 21st century, we're learning that, there is a neurophysiology for healing. There's a neurophysiology for building relationships. And I think we could do more research about that so that we can build the scientific case for putting the effort in to moving away from polarization and division toward our common humanity. And that's really the North Star of this work, is to find a way to learn to see ourselves in one another, to demonstrate empathy and compassion and caring. And there are health benefits from that. And so this is another area of research that is wide open right now. And I really encourage folks to do that research as well.
Incredibly valuable insight. Thank you so much for that. You've given us some wonderful targets for thinking about new research in this space and how to be able to make use of the amazing resources that the National Collaborative has created for us. So we do have some other questions that have come in from audience members. I want to tackle some of these as well. One general question asks, how do you measure the success of the framework? And I think we're talking about the Truth, Racial Healing, and Transformation framework that is woven through the pillar initiatives of the collaborative. How do you measure the success of that framework and your efforts generally as a collaborative?
So I would say that because it is locally based, the success of the framework would be aligned with local efforts to implement that framework. And the first sort of retrospective evaluation of those local efforts and attempt to measure is a report that can be found at the W.K. Kellogg website under their section Healing Our Communities. And their evaluators, talked with the local communities that are implementing, and they set their goals and they measure their success based on how close they've come to achieving those goals. And often they are quantifiable goals. I think the one that stands out most in my mind from a standpoint of societal change or community change is Buffalo, New York. And Buffalo, New York has increased economic opportunities. They've reduced discrimination in terms of access to resources to start small businesses. They've done tremendous work that aligns with the economy pillar. So the short answer is that each implementation site, be it a college campus or a local community, they set goals. We have a process that we call the plan for action, and it begins with the community establishing a vision for success for each pillar of the framework. So that community pulls together a diverse coalition, and they divide into teams, and they create a vision for what will the new narrative be. What will the relationship landscape look like? The networking, then that can be measured and documented in terms of the expansion and change in relationships and networks. And then they have a vision for what will their community be like when they've overcome the legacy of segregation and separation and redlining, et cetera. They have specific vision for what their transformed legal and governance systems look like when they are more inclusive and representative and more effective in addressing equity. And what will the economy, how will it change? How will it be transformed? So they start with a vision, and the next step in their process is to do landscape analysis using data to determine, well, if that's our vision for the future, where are we now? So that we have benchmarks for measuring our progress. And then the next step is to determine who needs to be there as part of this work, who might not be in the room to achieve that broader vision. And then they move into their necessary action steps to achieve measurable outcomes, and then their efforts to provide the resources to sustain the work. So it's a 5-step process, and they then are able to monitor progress and to measure, the effectiveness of what they have as a community have decided to do.
Fantastic. That's really helpful. And I think it also helpful to think about that, the framework you're using for evaluation and what that might, what lessons that might offer the other research initiatives that are studying these similar issues. So thank you for that. Another question reflects back on the work of Isabel Wilkerson in her book Caste. A question about that book makes the case that racism serves the economic interests of people who are tend to be at the top of the distribution. Just a question about whether that perspective is how that perspective might be reflected in the Truth, Racial Healing and Transformation framework and in the pillar initiatives of the collaborative.
Thank you. We were pleased to work with Isabel Wilkerson over the 10 years prior to launching TRHT. She was a repeated guest with our national convenings, and so we were happy to see her book Caste. We invited her in based on her previous book, which was The Warmth of Other Suns, which is a really compelling narrative about the Great Migration of Black people from the South. And clearly, the economy pillar is reflected. Definitely, our nation's economy was fueled by racial hierarchy, and our economy is designed to sustain racial hierarchy, and it's visible in the major wealth gaps that we see. But if you look at our Healing Through Policy briefs, you'll see examples of amazing efforts on the part of local communities to create some sort of just economic equity and fairness, everything from fighting for a living wage, to the union movement in this country. I would also recommend another book that is really it was informed by our work, but it's called The Sum of Us: What Racism Costs All of Us and How We Can Prosper Together. And in full disclosure, this New York Times best-selling author is my daughter, Heather McGee, but the book definitely focuses in on the economic consequences of this adherence to this fallacy of a hierarchy of humanity.
Fantastic. Very, very helpful. Those are excellent, excellent resources. Another question from one of our participants is from a researcher studying African-American infant mortality and that problem. This person's asking, is trying to find more data about that particular health disparity and about data that can provide lenses into social determinants that may be supporting health disparities in regards to infant mortality. Can we offer some general advice about how to collect data that could be richer and more informative about that particular problem among mothers and their interface with the healthcare team around disparities there?
Wow, that's such a powerful question, and I certainly invite my colleagues to weigh in. Some of you who know me and know my work, you know, it was the death of my own infant that launched me into a lifetime of attempting to end health inequities. So it's certainly been a journey. The National Collaborative for Health Equity, in its first iteration as the Health Policy Institute of the Joint Center for Political and Economic Studies, we had a commission on this very issue while I was there, and it was called The Courage to Love. And we took a holistic approach to examining the persistent problem of not just infant mortality, but maternal mortality. And it was amazing, some of the myths, you know, some of the work we looked at was how first-generation immigrants, for instance, of color, African immigrants, do not have the same infant mortality dynamics that are associated with second and third generation. So there's something about being in America that seems to increase the risk, right? And we believe it's exposure to racism and to the stress that's increased by exposure to racism and the denial of our full value as human beings. There's tremendous work that's been done on the effects of chronic stress and the effects that has on vulnerability to low birth weight and to infant mortality and to maternal mortality. For the first time, we have, under the leadership of Vice President Kamala Harris, we actually had a White House focus on this issue. So there is a lot of new information emerging. The Kellogg Foundation, under its health equity, has taken a major focus on infant mortality and prevention, and there are resources there at the Kellogg Foundation website. We had a huge initiative on optimizing access to mother's milk, to breastfeeding. This makes a difference in terms of the longevity and the quality of life of infants, even those that experience low birth weight and prematurity. So there is a lot of information that's emerging out there now. A new book is about to come out in the fall from the American Public Health Association, edited by Dr. Regina Davis, that is a collection of the landmark studies in this work, as well as the new evidence that's emerging. So keep an eye out for this publication from the American Public Health Association. And we'll see if we can make available our original concluding report on the Commission to Love, but it's dated. It was 20 years ago, but unfortunately, you know, we still have the problem. So my short answer would be that there's a lot of new information emerging. We are making a little progress on some of the interventions to improve the lives of mothers and of infants of color, but I'm hoping that we'll accelerate that progress.
And if I may add to that, thank you for that, Dr. Christopher. CDC, if you're aware, has a pregnancy risk assessment monitoring system surveillance that collects a plethora of data related to infant and mortality outcomes. They actually ask a question, or they make a question available for states to ask respondents on their experiences with racism while seeking out prenatal and perinatal care. It is also my understanding that they are working on updating the current version of the surveillance system to include a module focused on social determinants of health, which is extremely encouraging, and it again is on the heels on a lot of the federal and legislative work that is coming out of the White House and the executive orders to support examining a plethora of health related issues through that racial and health equity lens. So I would definitely like to offer that up. I would also suggest even checking out some of the resources offered by the Commonwealth Fund. They include information about policies and legislation that is being passed across the country to support addressing and reducing some of the adverse outcomes that we're seeing across maternal and infant mortality.
Thank you, Ina. I also want to guide you to the HOPE initiative and the HOPE data interactive tool, the HOPE Index. Under the health outcomes domain, you will find infant mortality and low birth weights as two indicators where you can go into this interactive tool on site and see how your state is faring as far as those two indicators, and possibly engage in some brainstorming on how you can improve that percentage based on what your goal is in your current area. So that would be another resource for you to consider.
Mm-hmm. Thank you. And I just, in terms of innovation, research is coming out of Columbia University that is looking at environmental toxicity and particulate matter in the air that is associated with premature births, and certainly greater vulnerability to COVID was associated with this higher degrees of pollution in the air of communities of color. So what we're finding is a broader, more comprehensive and holistic approach to how do we address the environment? How do we address the conditions in which people live, both before they conceive and during the pregnancy, and the generational dynamics associated with that? But thank you very much for the question.
Fantastic. And I know we're almost out of time. I've got several questions we haven't gotten to yet. Some of them asking for more information about specific resources that our panelists have shared, or about how to engage with things like the HOPE data initiative. So we will follow up with those question askers offline after the session today, with links to more information from some of the resources that our panelists have mentioned. So if we didn't get to your question just right now, we'll be following up. And I do want to again make sure that to thank all of our panelists today at the National Collaborative for Health Equity for giving us a tour through the amazing work that is happening there around truth, racial healing, and transformation, and dismantling racism and racial hierarchy. You've given us lots of food for thought about how to integrate these concepts and tools and practices into our own research. And I hope we can continue to dialogue with you and as we move forward in this larger research agenda with you. So thank you again. Thank you to Dr. Christopher. Thank you to Ina Robinson. Thank you to Luz Benitez Delgato. And thanks to all of you for joining us today. And we look forward to seeing you again at future webinars of the Systems for Action Research Program. So long, everybody. Enjoy the rest of your day.
Thank you.
Bye-bye.